are we?
I think, that's a very important question, El Padrino, because we often never factor in political will. Right? And this is why it was such a concern when we never acknowledge GBV for what it is. Because if you don't have the political will to name it, you might not have the political will to allocate a budget to it. And I think for us, what we're sitting and hoping for is, that, for example, especially when you're speaking about US government-related money, when you look at our HIV response, we must also acknowledge what Botswana has at least 340,000 Botswana living with HIV, right? And if you look at our HIV response, PEPFAR has been funding it, especially, at least in the last 2 financial years, by 32%. During the COVID pandemic, it was by 26%, but we can acknowledge what it was COVID, right? And when you look at for the preceding 5 years, it was a minimum of 30 upwards to 36%. So that's a significant portion of funding that's going towards the HIV response. And we're talking about HIV testing and counseling, lab capacity, staffing in some instances, technical capacity, working with disadvantaged groups that maybe primarily there's no political will to service them in government facilities. We're talking about commodities such as lubricants and so forth. And so I think for us, it's obviously a hope that the government will, one, respect its commitment to the Abuja Declaration, where AU member states made a commitment to spend at least 15% of the government's budget to public health. And so we haven't been seeing that. If you look at the previous financial year, it was estimated at 17% of the recurrent budget. And then when you look at the development budget, it wasn't really there. UNICEF Botswana in 2019 actually reported that it was at 12% of the state spending. So I think for me, if we're able to then actually make sure that we are fulfilling that commitment, 15% in terms of state spending, then hopefully that unlocks certain resources. I mean, we're seeing it with so many new health practitioners having been employed. That's a positive development. But what are we doing now for certain communities that don't necessarily have enough resources? For example, health post in the surrounding villages, and you only have 2 nurses. So we need to obviously strengthen our primary health care. We need to make sure that it can respond to lived experiences, because we know that social behavior and people's behavior changes, especially with all these increased heat waves and the cyclones and other climate issues that are emerging.
It's very interesting that you touched on something that I think a lot of us tend to overlook when it comes to HIV and AIDS, because most people, when you talk about HIV and AIDS, you talk about the ARV pills, and the government. I think Dr. Christopher Nyanga, the Botswana government does have the capacity to be able to still buy or purchase the pills, as that's what they've been doing. But when you talk about the disease, there's so much more to it than actually just taking medication. So I really, really like that point very, very much. As Success Capital, you guys go over and above in terms of advocacy. You also want to speak to other issues concerning things like youth unemployment. Looking at the budget, what are we hoping to see?
So I think for us, firstly, we'd want to see a well-being economy. If you look at a lot of European countries that came out of the Second World War, they were basically socialist states, right? Where they were investing in social infrastructure. So can we have meaningful recreational facilities? We just saw the JC results where so many kids are not able to make it or progress. What does that mean about those who fall out of the system? Never mind that, the other 25,000 that have been falling out of the system the entire time. And so how are we ensuring that we're strengthening a well-being economy in taking care and strengthening mental health? One. Secondly, ensuring that there's some form of skills upliftment. Because then hopefully technical and vocational training can be an avenue where we make sure that we can get more artisans, essentially building on some of the skills shortages that we have long identified, right? And particularly through TVET systems. How do we ensure that we can encourage I think we've got a problem where in any instance where you've got a tender culture or you've got people who are earning money, they tend to go and spend it outside, right? People actually literally say that it's much cheaper for you to go to Cape Town than go to Botswana, as an example. So how do we ensure a circular economy? How do we create the kinds of incentives that encourage citizens to spend money in the country? How do we ensure that young people can actually participate beyond just, if you look now, agricultural programs? Because there's an assumption that everyone will have an interest in agriculture, right? But how do we stimulate an environment where, if we're saying that we want to be a center of meetings and international conferences, what within that value chain can we take advantage of to ensure that young people can be engaged, if not for long term, at least short term?
Now, just last week, the Ministry of State President launched the listening tour, and what has been said for quite some time now is that it's not a secret. Our president is a human rights activist, and in terms of fulfilling human rights commitment, because this is the human rights government, will it be reflected? Are you hoping for it to be reflected in the budget speech, and looking at the listening tour, will it address the human rights side of things?
I mean, I think for me, it's wanting some element of consistency, right, in the respect and promotion of human rights, right? Firstly, if there's no resources, what's happening around the listening tour, because that's resources as well. If there's no resources, what's happening with the continuation of international trips? We understand we need to rebuild the economy, but why is that occurring, right? What happened to, the cuts? The same Ministry of the Presidency said that they were going to be cutting their own salaries. So what happened with that? So I think, for me, it's you have to practice what you preach, right? Human rights is not a tap that you open and decide to close at any convenient point. It's about dignity and personhood. So how do we make sure that they're meaningful? One, universal income floors for people. Since now we're hearing what make an cost to company, certain legal loopholes that people can take advantage of. And it's not to say that, I think for us as Success Capital is to say we want the material conditions of Botswana to change. You can come and play around with the tools, you can tweak whatever tax loopholes, but the reality is we want material conditions to change.